Welcome to the Allura Home Health Vlog. This is a spot where you can get thought leadership, information on topics that matter to your agency today. Today's topic, the 10-step guide to growing your home health agency. If you're looking to grow your agency, this can be the year to build that census you want. We're going to talk about 10 impactful moves that you can make now. Maybe you have no idea where to begin, or perhaps you have too many ideas to decide on which move to make first. No need for guesswork. In this guide, we're going to lay it all out. 10 impactful moves to make right now to get organized, focused, and primed for growth. Number 1, check out the competition. One impactful step to growing your business is to check out all of the competition. Your home health agency must be the number one go-to choice for referral sources if you want to expand this year. The process of identifying similar businesses or services in your market is called competitive analysis. It's an important part of the growth plan because it gives helpful insight about how others see you. Potential referral sources and customers will compare your agency to the competition. You need to be the top choice. To make this important move, first, figure out who the competition is. If you're unsure, ask around or look online. Determine who your top 3 competitors are. Think about other companies in your area offering the same services. You might want to think about agencies that are the same size or have a similar census. Next, think about what your home health agency offers that others do not. Could you provide a specialized surgical rehabilitation program that no one in the area has? What about attracting more specialized nurses or therapists through incentives or better pay? Your growth plan could start with a good look at the competition and some ideas on how to be better. Second, know your retention plan. When it comes to beating the competition, human resources is a great place to start. Staff retention should be an integral part of the plan for growth this year. Think about these statistics on healthcare workers and their implications. By 2025, there will be a shortage of nearly 1/2 million home health aides. As of February 2021, registered nursing was the 4th most in-demand job. A recent study predicted that over 1 million RNs will retire from the workforce between now and 2030. It's time to answer questions such as how will you retain your hardworking, well-trained staff? And how can you compete against bigger businesses like hospital networks that can afford to offer more for home health clinicians? These are difficult challenges to consider, and the bottom line is you can't grow without staff. One key will be to retain the staff you already have. Plan for how to accomplish this. Get creative and think outside the box. Creating a culture that makes staff feel valued, offering continued education and opportunities to upskill, as well as promoting from within, are a few ways to gain loyalty. Invest in your team in big ways to make sure they stick around. Number 3, change the way you're recruiting. Hand in hand with retention, recruiting is another critical area to consider when planning for growth. Home health clinicians are often overworked and understaffed. Harvard Business Review found that healthcare employees are among the largest group of workers quitting their jobs because of extreme work demands and burnout. The next step that will impact your growth is to change the way you're recruiting. You must build a smarter recruiting strategy. First, change up that generic ad on Indeed. Your job board posting must stand out. Give real-world context to your ad. Consider telling potential applicants exactly what types of patients they will see, what technologies they'll use, and why your staff loves your company. Qualified clinicians with the right skill sets don't want to waste their time. They want an idea up front of whether the job position is a good fit for them. Agencies will get more activity from a quality post with a detailed description, and the responses will be more of what they're looking for. People love a story because they can connect with it. Consider sharing real-life stories from staff that joined your agency and thrived in the job flexibility, company culture, or work-life balance. Secondly, if you're not working with a healthcare recruiter, it might be time to think about going that route. Healthcare recruiters are laser-focused on finding the right nurse, therapist, or aide for you. Typically, they can devote time to finding and screening candidates that your managers can't. In today's labor shortage, it's wise to use all the tools at your disposal. Using a recruiter for your next hire is a move that can impact your agency. Number 4, take an objective look at your agency. Another big impact move for owners looking to grow their home health business is an objective look at their agency. Take a step back, consider facts, not feelings. What are the company's strengths and where are the weaknesses? Are there departments, key stakeholders, or processes that need attention before the agency can scale effectively? An objective look at the agency will give valuable insight. Start with a pen and paper or digital notepad. Draw 2 columns. Brainstorm some of the positives and the negatives of your agency as it is today. Then let this list guide the decisions over the next 6 to 12 months. Number 5, strengthen current partnerships. The next big move to accelerate growth this year is to strengthen current partnerships. The relationships you have now with your employees, your providers, and the community are valuable. Let them know that their contributions to the agency's success are important. Spend some time, energy, and resources this year to foster the connections you already have in place. Take some additional time to think about referral sources, business partnerships, and team members who helped your agency's growth in the past. Call on them again to make your next push for growth this year. Beware of neglecting those who have gotten you to this point. Never let the excitement of growing and making new partners overshadow the team that built the foundation. Number 6, leverage your data. The next move will not require much of an investment, but it can contribute to the growth in a big way. Right now, you should be leveraging your agency's data to inform growth strategies. Every agency is unique, and that's why agency leaders need the current numbers and reports to grow and improve. Think of all the valuable information that is already at your fingertips. OASIS reports tell owners what kinds of patients they're serving. Marketing reports show where patients are coming from. The data that home health agencies already collect provides a wealth of business intelligence. Use the information to formulate the next campaign. In fact, sales teams can look at the current census and providers to gain a sense of the potential market. Then they can drill down to look for new opportunities. Leveraging your data is key, and your current reports can help you optimize growth this year. Number 7, examine your social media strategy. This next move is more of a requirement than a suggestion. Now is the time to examine your social media strategy. Are you using the agency's social media presence to gain customers and expand the brand? If not, you should be. One of the great things about social media is that it's free to access. Today, it's safe to say that almost everyone you know has a social media account. Platforms like Facebook, Instagram, and Twitter give businesses access to a broad audience with relatively little cost and effort. Depending on an agency's marketing budget, they can manage social accounts internally or outsource tasks. Either route is fine, as long as an agency does not neglect this powerful tool for growth. There are a number of home health forums inside of Facebook, for instance, where you can connect with thousands upon thousands of caregivers all over the U.S., and particularly in your local market. Consider scouting and joining a few of those groups so you can interact and put your agency at the forefront on the topics that matter. Here are a few ways that social media platforms can spark growth for a home health agency. Posting blogs helps families with questions about home health. Activity in local Facebook groups attract nurses and aides looking for work. Updates about events announce an agency's presence in the community. Another social media strategy that agencies can't afford to disregard is search engine optimization. Companies putting content on the web must make sure that it is visible. It does no good to post if no one sees it. Spend some time and energy learning how to optimize what you put out there to get the most return on your investment. Number 8, capitalize and double down on digital technologies. While foundational platforms like good home health software are critical to establish the baseline, if expansive activities like planning for social media excites you, then you are on the right path to grow this year. That's because the healthcare industry has digitized in an unprecedented way since the pandemic. The American Hospital Association suggests a shift from doing digital to being digital. A sure way to make a big impact for growth this year is to double down on these digital technologies. For instance, digital services for your website can grow your census by getting leads. Think about this. Seniors and caregivers are getting more proactive about their care. Perhaps someone hears about home health and has questions, so they're searching online after work when the office is closed. But a chatbot on the website engages them and captures the contact information for a quick introductory call. Moreover, online technologies help with recruiting and retention. Communication platforms are facilitating virtual interviews and remote work. Both contribute to work-life balance and are very attractive in today's competitive labor market. Another digital technology emerging in home care is telehealth. Medicare doesn't pay for virtual visits provided by home health agencies, but that doesn't mean telehealth is useless. Video streaming and conference services keep patients engaged, and they are attractive to doctors who can count on you to care for their patients. Evidence is showing telemedicine can improve care outcomes, patient engagement, and physician satisfaction. If you're not already, it's time to jump on the digital transformation bandwagon. This year, think of how you can get ahead of the competition by using healthcare technologies to your advantage. Number 9, own your online reviews. These days, patients and caregivers expect more from home health agencies. They're looking for quality care and great customer service. The best way to let potential customers know about your agency is to have positive reviews from current patients and staff. Online reviews are today's digital currency. Take, for example, Yelp. It's a multi-billion-dollar empire built on consumer reviews. People want to see business reviews. Your online reviews matter. If you haven't been owning your online reviews, here's what to do now. Claim your business on Google and Yelp. Ensure your information is complete and accurate to boost your website's SEO. Then cover the secondary sites, lead generation websites like care.com, caring.com, Place for Mom, Senior Advisor, and Aging Care should have an accurate listing for your business. Make sure they show locations and what services you offer. Use real photos, not generic stock photos. Show who you are. Authenticity stands out. After you set up accounts, make sure someone monitors them. The sales and marketing team would be great at this. Once the sites are set up, spread the word. Feature quick links to the online reviews on your website. Use the links in email signatures. Let everyone know you're online and ask for reviews. When you hear about success, invite the patient, family, or employee to give a public review online. Let them know that their feedback helps others find you. Finally, use these online reviews, both positive and negative, internally for performance improvement. Number 10, clarify and communicate your vision. If you're ready for explosive growth this year, there's one last impactful move to make. To expand your business, you must have a solid team behind you. When it comes to your home health agency, you can't grow it alone. It would be impossible to execute these moves without time, energy, and ideas from others who are invested like you are. So if you don't have a team behind you already, how do you get one? Clarify and communicate your vision. When your team catches the dream, it will be easier to move forward because everyone will be rowing in the same direction. Define your goals and share them with your team. Talk specifically about why you want this to be your team's year. Maybe it's because you want to care for more of the vulnerable patients who need help. What about providing the best home health care in the city? Get clear on the why behind the goal, and then convey that message to everyone in the organization. Put positive energy behind it, and your vision will be contagious. So there you have it, the 10 most impactful moves that you can make now. You have your work cut out for you, but implementing some or all of these steps now will move you in the right direction for major growth this year. So get your team together and start dreaming about where you will be this time next year. What are you waiting for? Thanks for watching. And to view more home health vlogs, visit our YouTube channel at youtube.com/homehealthsoftwares. Check out our playlists for more thought-provoking blogs, or learn more about our home health software at alorahealth.com.